Hey guys, welcome back to my channel. If you are new here, in my last video I discussed dental implants and the things that could go wrong, and I left off in my last video that I was going to go to Emory Hospital in Atlanta, Georgia to see what I was going to have to go through next with this dental implant disaster that I'm going through. Nightmare, actually. With that being said, I did go to Emory, and if you are new here, you can go back and watch my other video about dental implants. Nightmare. But I did have the all-on 4 dental implants put on the bottom, which means I have a fixed bridge that is fixed with 4 screws. And when they were putting my device in, or my bridge, they broke my jaw. So after that, it set up a really bad bone infection, and I'm going through that now as we speak. If you can see how much of an incline it goes, like these teeth are up here, and these teeth are like way down here. It's because my bone right here literally has deteriorated. You know what I'm talking about. Sorry, I'm from the South. I talk a little slang. But anyways, yeah, my bone is deteriorated, and because of the bone infection. So the bad news that I learned at Emory yesterday is that not only do I have to have a emergency surgery, where they're going to have to go in and scrape out the inside of my jawbone to get the infection out, and also have a PICC line, which is an IV, intravenously antibiotics, for 4 to 6 months. But I'm going to have to lose not 1, but 2 implants. I am disgusted. As you have, learned in my other video, I paid almost $30,000 for my all-on 4 implants on the bottom only. So to lose these 2 implants is devastating, because a bridge cannot be supported by 2 over here. There is no, it just can't. It can't. So I've got to go back and have this emergency surgery. They've got to clean out my bone. I've got to lose both of these implants. They've got to do a biopsy. It's a mess. I've got so much to go through. So I started doing this blog so I could help, and even if it helps one person, because I've been looking at dental implants for years. I started watching Callan Jack's, her channel. I swear it feels like 10 years ago, when she started talking about dentures and then implants. And so not only have I been researching these implants for 8 to 10 years, I finally decided to get them, and $30,000 later I did get them, but I got a lot more than that. I'm out of 30 grand. I am out of 2 implants I've got to lose. I've got to have multiple more surgeries, which means I've got to be out of work again. It's just a mess. So, and I'm going to vlog the entire experience, even my surgeries. But when I made my first videos about implant nightmare because as I said in the other video, I have not found not one other video at all with anybody that's had a bad experience. And guys, all on four is implants is definitely the way you want to go more than dentures. So I'm not trying to steer you off of that at all. If you want to be able to, eat like, natural teeth without having adhesives, and if you want the natural go, if you lose your natural teeth, definitely go with implants if you can afford it. Now, what I will tell you that I wish I would have done, I wish I would have went with the snap-in dentures or implants first, because it's not so invasive. They use a smaller implant, so maybe my bone would not have broke. And this next surgery would not be as bad because all they would have to do is snap my implant denture or bridge, snap my bridge out, do the surgery, and put it back in. But with having fixed, screws, into your jaw. So yeah, you can always say, I wish I woulda, coulda, woulda, but no, it's done and over with. All on fours is a great thing to get. Unfortunately, you need to know the risks, okay? I didn't have anybody that I could, follow on YouTube or TikTok or anything like that went through a bad experience. So I had to go through it. And so, like I said, there's going to be people out here like me that have a bad experience, and I want to be able to help them with any questions or, concerns or whatever, because I didn't have anybody that's online talking about anything to do with implant failure at all. Especially, somebody vlogging their experience at all. So that's why I made this channel, or this series. And I will keep you guys updated if there's anything that you guys want to know about anything specific to do with my all-on-four implants. Just let me know for sure, and I will definitely answer them the best that I can. It has been a ride, that is for sure. Nobody wants to pay $30,000 and not get what you paid for. You know what I mean? Like, nobody wants to pay $30,000 and not get your money's, like, you know what I mean? Yeah, it's crazy. I got my implants in March of 2023, and it's now July of 2023. So it's been 4 months, and it's been 4 months of hell. Like, I should be able to eat anything I want right now. Like, seriously. But no. Matter of fact, I'm on a stricter diet now than I was before I got the implants. Go figure. And it's because the infection is so bad in my bone that even when I talk, and I'm sure you probably can notice it, but I have to, when I say my words, I have to stop before my teeth touch, especially on this side. Because if it touches, it's like an open nerve pain that will send me out the bitchin' roof, okay? Like, negative. Can't do it. Nope, not today. Not today, Junior. Awful. Awful pain. So, do your research. And like I said, I did my research for 8 to 10 years, okay? Yes, I say different words weird, and I did it for 8 to 10 years. But like I said, there was nobody out there vlogging their experience who had a negative, bad experience as I have. And that's why I'm doing what I'm doing. Because like I said, if I can help one person, that's fine with me. Because if there was one person that was out there that was vlogging it, they could have helped me. And I would have known, you know, maybe the signs to look forward or look, you know, for after the implants were placed or etc. But I didn't. I've been on antibiotics for 4 months, literally. You know, at one time, a couple weeks after my implants were placed, I had a golf ball size knot right here. A golf ball size knot. Yeah, I've been through it all. So, and I didn't want this video to be this long. I just wanted to update you guys on my Emory trip. But I'm also going to make a detailed list of implant failure. Not list, but a video of implant failure, signs to what to look for immediately after your implants were placed for failure. Because most, 96, they say, % of the time, if you have implant failure, you're not going to have early failure. You're going to have late failure. Like if you've had them for a long time and you have a bad habit of biting and, you know, gritting your teeth really bad and you don't wear your night guard, you know, or, you know, severe bone loss. Just, normally you don't have an early implant failure. It's pretty rare, but it is a case because here I am. But I'm going to make another video of things to look for early implant failure and late implant failure. And just different signs to make sure and look forward if it does happen, what to do. Also, I'm going to, you know, in that video, I'm just going to have a whole bunch of information on new with implants. So if that is something that you definitely are interested in seeing, if you are newly with implants, or you have a, you know, an appointment date to get implants placed, anything like that, or if you just want to know what, you know, I've been going through for the past couple of months, whatever it is, okay, if this is something you want to do, shout me out a comment, leave me a like, let me know, and I will definitely make that video, and I'll try to have it out tomorrow for you guys, and I'll take you through this whole experience. So, with all of that being said, I hope you guys have a phenomenal day. Today is hump day. So, yeah, right on out on this hump day, guys. And until the next one, see ya.